So how are you doing today, Professor
I'm
Kleinman?
doing well. I'm doing well.
Okay. Thank you for joining us. So you showed incredible strength when you care your wife for 10 years.
Yeah.
We would like to learn from you.
Okay, well, you can learn from me by reading my book, The Soul of Care, where I put everything that I experienced in taking care of my wife there. But you must realize that I have worked in caregiving and care for half a century and have written many books in this area and done lots of research, some in China and some in the United States.
Yes, I read your book, The Soul of Care. It's a highly praised book, and it's also translated for several languages, right?
Yes, yes, it's in Chinese, Japanese, Korean, and other languages, Thai, etc.
Yeah, so I enjoy reading it. I recommend everyone should read it. What's your takeaway? Like, how would you give advice for other families care of people with dementia? What's your top advice?
Well, the most important thing to realize is that there's no universal advice. Everything is based on a particular family and their context. If you have a strong relationship with your spouse or your parent, whoever has dementia, and you have adequate funding, you're in a very different situation from those who don't have good relationships or have problematic relationships and have limited finances. So finances, to begin with, are hugely important because care for dementia is one of the most expensive forms of illness to require care. And so the beginning is to recognize your own situation. Do you have the resources to take care of someone? And let's think about this a little bit on resources. You're Canadian, so I don't know the situation in Canada, but in the United States, very few people have long-term care insurance, very few. Hence, very few people are insured to have a home health aide come in and help them. But if we were citizens of Japan, of Holland, Germany, Denmark, Sweden, Finland, Norway, all of those countries' national health systems provide the resources to have a family helped by a home health aide. I found in my experience that was the single most important thing. Why is that? Because the danger, the problems for the person who is giving the care of caregiving is that you become overwhelmed with the task and you can't get away from it. And it begins to affect you, and you begin to feel stress and hurt and injury and tired and lonely. And all those things can be averted in several ways. One, by having some access to a home health aide or family members who are willing to come in and spend time each week with the person requiring care so that you can get away for a while and do your own work, shopping, whatever, go to the gym, whatever is necessary to keep you going. Okay, so that's number one, I think. Number two is that the problem of care is how do you keep yourself present for the person who you're caring for, alive and there for them, being there for them, not doing things automatically or mechanically, etc. How do you keep that presence going? And I think, again, this is probably different for every family, okay, and every individual. But I found this to be very important. And often it's the love you have for the person who you care for, the parent or the spouse, that brings out of you that presence, so that you're not just doing things as if it was a routine and you were disinterested, but you're doing it with love, with energy, with your full presence. And that's really important for the person being cared for, as well as for the caregiver. Third is the understanding that this is going to take time over time. So this is not just that you're putting in a lot of hours on one day or 1 week, but this is going to go on for months, for years. And so you need to learn how to endure. Now, I use the term endurance rather than the term resilience, because frankly, I think resilience is a pop psychology Hollywood term that is very romantic and generally wrong. It has the idea that we're all rubber bands and we can be stretched as wide as possible. And when you let go, we come back to the same shape. Not true. Rubber bands become brittle over time and they break. They don't go back to the same shape. It's how you endure, how you keep going. That's the key. And I think that anything that helps you endure and keep going is crucial. Okay. The fourth, I'm right, fourth or fifth, whatever I'm up to, issue here is that caring doesn't stop when the person dies. And that's very important to recognize. That bereavement, grief, mourning, they all mean the same thing. We grieve through memories, through our remembering, our memories of the person we've cared for, and our own caregiving. And it's the care of those memories that goes on in time with our lives. So, that's basically what it is. Now, I've left out, of course, the everyday actions. And what are those everyday actions? Those are helping someone to ambulate, to walk, helping feed them if they need to be helped with feeding, helping dress them, bathe them, doing all those practical assistance, protecting them, because a person who has dementia can get hurt, fall downstairs, injure themselves, etc. So you need to do all those things. Those are the practical tasks. But actually, the practical tasks become easier over time, whereas the emotional tasks and the moral tasks of giving solidarity and support, they become more difficult over time. Why did the practical tasks become more easy over time? Because we make them a routine part of our everyday life. So we know when we get up in the morning and we're taking care of someone who has dementia, we have to help them go to the bathroom, we have to help them wash up, we have to help them dress and then have breakfast, et cetera, et cetera. All those acts get ritualized. Now, I'm an anthropologist as well as a physician. And in anthropology, we believe that ritual, organizing habits collectively as actions over time that take place the same way every time you do that, makes life easier. In the same way that your own habits, good habits, makes life easier. So that's why I say that over time, the practical acts of assistance become easier, while the emotional side becomes more difficult.
I'm really impressed by your endurance. My dad had a dementia. My mom cared my dad for 7 years. My dad passed away 2 years ago, and it was very difficult time for my mom as well as myself. And my mom did all by herself. I hope I had this knowledge when my dad was alive. So I'm happy to interview you today and hope to get more message out to our audience, so they are more equipped to take care of their family with dementia.
Did your mom have people help her? Did you or your siblings help her? Did she have a home health aide?
Okay, I'm the only one. I'm the only child. So my mom is very strong person, you know, and she tried not to bother me. If she felt that she want her managed by herself. I tried to get PSW, which is healthcare aid, to help, but my mom didn't like it. My mom said, no, I don't like the way they doing things. She had the certain way doing things for my dad. So basically she did all by herself.
And what effect did the caregiving have on her?
She was very tired. She was exhausted.
Yeah. So we know that for family caregivers, not just for dementia, but for any serious illness in a family member that goes on for a while, that the family caregivers often have worse health, not only become tired, but often become sick at some stage themselves. However, the one good thing is that when you ask family caregivers later on, after the person has died, what they got out of the experience, like me, and perhaps like your mom, they say that they got a lot out of the experience and feel that they did accomplish something that was there to do, and their vows, their love, their commitment to the other person was fulfilled. They did it. Was there to do, they did it. Okay? They would rather that it wasn't there, but it was there, it had to be done, and they did it. I go into a lot of discussion of that in my book. How do people don't quite decide to take care of someone who has dementia or requires a significant family care. It's there, it has to be done, they do it. Okay? That's not a decision, it's a practice, it's an active engagement that's part of the entanglements of life.
I agree with you.